with our good friend Caleb Saylor's Multimedia Journalist, SuperTalk Mississippi News.
There it is.
Very important. Got to have the iconic sounds there.
I hear this jingle 17,000 times a day, so I'm like used to it.
All right, tell us what's going on, Caleb. What do you got? What Palmer Home Radiothon yesterday? It was a big day.
Yes, big day, record-breaking day, and it's really good, for a good cause for the children and everything. But raised over $367,000, and but not only that, though, you were there yesterday, and we had other shows there. You got to hear the testimonies from the children, the staff, and donors, and people who have been involved, and it's just really good to support and champion a good cause like that. And people literally put their money where their mouth was to help operations and facilities at Palmer Home for Children.
I think it truly illustrates just the generosity, the charity of Mississippians, and we're so grateful for them for helping us out on that day, which comes around once a year, of course. 2023 set a record, the 11th annual Palmer Home for Children Radiothon for SuperTalk, and it's really an honor to be a part of it. Part of the SuperTalk team, honestly, because Palmer Home does just fantastic work. They,
Absolutely.
of course, receive no funds from the public sector. All of their funding comes from private donations. Mm-hmm. And people in Mississippi are so generous and reach into their pockets, and no amount is too small, as we've said so many times. We had just a number of great people that called in or went online and made donations, and we ended up with $367,000 that will be put to good work to rescue, restore the lives, provide health and love, safety.
And I think that's
vulnerable children.
I agree, and I think that's why people were so willing to donate too, because they know it is for a good cause.
Yeah, no doubt about it. All right, what else is going on?
Well, before I get into anything super important, I want to say today is World Snake Day. And for everybody, all the reptile lovers, the Mississippi Museum for Natural Science here in Jackson is having like a big display of snakes. If you want to walk around and see snakes on display or hear a lecture about the difference between venomous and non-venomous snakes, you can go out to the Mississippi Museum of Natural Science until 2 o'clock p.m. So you got a couple more hours to go see the snakes on display, like out in the open, not like in the cages and everything.
Yeah. All right. North Mississippi, we were just talking about that. They announced some layoffs yesterday, but I can't find the details of exactly how many. Do you know?
No.
You guys know?
I don't know, but they said they'll be they've announced the layoffs, but they'll be laying off the employees in the coming weeks, and they cited financial reasons, increasing costs in labor and supplies and everything. And, Mississippi is is on the forefront of the national hospital crisis. We see what's been happening to hospitals statewide, having financial issues, having to scale down their services, lay off employees. And North Mississippi Health Services isn't the first one in the state. We've seen Greenwood LaFleur scale down their services. We've seen other hospitals in the state. But it's just, I guess, inflation, rising costs are hurting these hospitals and systems.
Yeah, I'm wondering about that because we hear that there's shortage of workers, healthcare workers. So that doesn't really square that in a period where we're hearing so many of the healthcare institutions complain about not being able to secure sufficient staff to conduct appropriate level of operations and staffing. And now all of a sudden they let people go. So I don't get it. We can't get any more information at this point.
No more information as of now.
Wow. Okay. So we also had KPC Promise Hospital. It's more of a recovery sort of facility, right? Once you've completed your hospital stay and your I guess discharge from the acute care hospital, and then you may stay there for additional recovery treatment and services. Apparently, they couldn't pay the bill, couldn't pay their rent, right, to merit. And so I guess they got evicted, is what I understand. So that's caused havoc with patients that were in the facility and staff and so forth. Just a big old mess. We've been talking about Brandon Presley seems to be focusing on health care as a campaign topic.
He's been focusing on healthcare, and recently you saw on Monday he unveiled his healthcare policy, and of that, one of the big things people are championing, we've had a lot of medical experts on this show, and we've had even Brandon Presley now in his campaign saying he wants to expand Medicaid coverage in Mississippi and thinks that would be something that would help hospitals in the state. And he even went as so far to say that he would replace the head of the Division of Medicaid in Mississippi, Drew Snyder. And I know you commented on the matter too, but they got into a little bit of a clash with the current governor's office because, Presley pretty much accused Snyder of being a political hack and said he would replace him with an actual person with a background in healthcare. Well, Governor Reeves' staff responded to us, actually, and said that, they think that Snyder's doing a great job and they're thankful for his service to Mississippi. And so there's a little bit of an issue there between the two candidates clashing on that. But yes, Presley is campaigning on giving more money to hospitals through Medicaid services.
Yeah, and honestly, I thought the attack on Drew was totally inappropriate and honestly beneath the dignity, in my view, of a person running for governor. Just my opinion. And I did go to my social media accounts to express my disapproval of that comment and also to compliment and to offer some praise to Drew Snyder. That is a very difficult job. It may be arguably the most challenging agency head job in the country, in the state. And
now they just restarted their process of, reviewing the eligibility of people on Medicaid too. So in the June renewal months, we had over 29,000 Medicaid recipients disenrolled from the program.
Yep.
And they expect more to come soon. And we had recently had, trying to think who was on, it was either your show or on Gallo that said that he expects up to 150,000 could be disenrolled by the end of the year.
And I think that's a fairly easy extrapolation because if you look at the number we had on the rolls before the law was passed in March of 2020, which required the continuous enrollment in exchange for an increase in the federal dollars because of COVID, where we were at that point with respect to the number of Mississippians on Medicaid and where we are now, it comes out to about 150,000, somewhere between 100 and 150,000 higher figure. So I think that stands to reason that's about the number we could expect that would be disenrolled.
And that was Bob Anderson, the head of the MDHS, who said that too. So came from a reputable source who said that. But it stands to reason more as you start to review eligibility, those who are just kind of automatically eligible because of the pandemic, because of the public health emergency, which is no longer in order now. It's naturally going to happen that way, that you're going to have disenrollments. Yeah, so April 1 is when the federal government said, look, you Medicaid programs in the 50 states, you've got to start disenrolling people who are no longer eligible because the continuous enrollment provision that was implemented in March of 20 is expiring. And by the way, we're going to pare back the federal match as well, the 6.2% increase. That phases out for the rest of the year. So we will get less money from the federal government. Therefore, we don't have as much to cover the expenses of the continuous enrollment provision, numbers of people that were added to our rolls. So, got to do that in order to make ends meet. Absolutely. Yeah. And on the sports side of things, you and I are both familiar with the Grove Collective, the NIL Ole Miss-based entity. Well, the Grove Collective joined an alliance literally called the Collective Alliance, and they're alongside Georgia, Tennessee, Florida State, USC, Penn State, and Michigan. So all historic programs. Neat to see Ole Miss as a part of that. Well, as Congress is still kind of coming up with uniform laws, NIL laws. They haven't voted on anything yet, but we've had Senator Roger Wicker talk about how he's trying to introduce NIL laws, trying to regulate it, put a salary cap in place and everything. Well, these schools are coming together in their alliance to formulate a plan to help compensate student athletes, but in like a matter that benefits all universities in the country. Because, you and I have talked about this, off the record about how much money these student athletes are making. Well, the NCAA looks like they're moving towards a revenue-sharing model, which could become problematic. Ooh. And yes, and Walker Jones from the Grove Collective said they want to go that route, but without having the student athletes become like employees of the university, so they're not regulated in that capacity. Interesting. Well, we'll see how all that develops. My personal opinion is that ultimately college athletics will be privatized. I think we're well on our way to that. I think so, too. That's what's going to happen.
In fact, I don't think most college athletes at that point will even be students. They'll just be athletes.
At that point, you're probably, with the amount of money they're making now, you're probably right.
Exactly. Focus on that craft. Make all your money that way.
Absolutely.
All right, Caleb, appreciate you coming in and giving us an update. I'm sure we'll be talking to you some more.
Good to be on, Gerard. Thank you for having me.
You got it. Caleb Saylors, multimedia journalist, SuperTalk Mississippi News, has been our guest. We're stepping aside for a break. Ashley Edwards at 12:05.